Cervical cancer deaths are forecast to rise to 416,000 by 2035. Uganda is set to roll out the human papillomavirus vaccination aimed at reducing the cervical cancer cases in the country, but the efforts to diagnose have hit a setback from another killer disease, HIV/AIDS, that has a connection to the cases. The two complement each other. Judith Ajani from the obstetrician and gynecologist ward in MILAGO adds that though more patients are diagnosed with cervical cancer, 80% of them are also living with HIV/AIDS. This not only puts a strain on the patient's life, but limits adherence to treatment.
One of the things that is very important now is co-infection with HIV. Patients who have HIV and cervical cancer tend to do very poorly over time because they cannot tolerate the radiation therapy very well, and they may have other illnesses coming as well, because the radiation therapy in itself and the chemotherapy I told you about tend to weaken a patient even further.
Cancer already has its complications. However, the additional AIDS care creates another head-spinning problem. The two are inseparable, but most worrying is scientists cannot explain the connection. Cervical cancer in Uganda is the most frequently diagnosed cancer among women and the most common cancer found in women between 15 and 44 years of age.
For you, if as a female partner you are married to a man whose previous wife died of cervical cancer, or you have a female relative who has died of cervical cancer, you are at risk for cervical cancer. And these probably rotate around the fact that if you have a female relative, it may be something in your genetic makeup.
Statistics from MILAGO National Referral Hospital put the burden at 7%, with 3,577 cases reported annually, 2,464 deaths registered, a figure expected to rise to 6,407 women living with cancer by 2025.
About 80% of the beds are occupied by patients who have cervical cancer. So cervical cancer is the commonest problem seen on the gyne cancer wards. And of all those who have been admitted, about 80 to 90% of the patients come in with late-stage cervical cancer.
Cervical cancer is a preventable disease which can be handled through early tests done free of charge in government hospitals and at a cost ranging from 30,000 shillings to 300,000 shillings in private facilities. Immunization to protect against human papillomavirus, together with screening and treatment, is the best strategy to rapidly reduce the burden of cervical cancer. National rollout of the human papillomavirus vaccine program in Uganda is expected this year.
To do the national rollout of HPV vaccine in October this year, and we are targeting 887,000 girls to be reached within the whole country.
The vaccination program is expected to regulate the catastrophe arising from the double tragedy. Zahara Namuli, NBS, Sunset.